Hello, hello. I'm so excited to be joined by my friend and colleague, Dr. Carolin Klein. Thank you so much for being here with us.
My
Uh,
pleasure.
I'm excited about your upcoming course, Understanding and Treating Genital and Sexual Pain. So tell us a little bit about what's going to be covered in the class.
Yeah, great. Well, I'm really excited about it as well. The class is going to be broken down into sort of four main things. The first one is just really understanding the common causes of sexual and genital pain and understanding some of the terminology that goes along with that. The second thing will be, I think it's really important when we're talking about pain that we actually understand how pain works. So I'm going to be talking about how pain actually works, and why it's so important for mental health providers, be that counselors, sex therapists, psychologists, to actually be involved in pain management. Third, I'm going to be covering a lot in the second half. The second half of the class will be really dedicated to evidence-based interventions for treating sexual pain and ways to actually communicate these interventions to our clients or patients. And then finally, I think it's really important that when we're treating sexual or genital pain, that we think about empowering our clients or patients to actually be involved in the treatment themselves. It's not just prescribing, do this, but how do we help them to really become engaged in the treatment process and see how much influence they have on managing their pain.
Amazing. And is sexual and genital pain common?
Yeah, yeah. I think so many times people have no clue about it, and our clients and patients come in thinking they're the only ones with it. And I think that's for a bunch of reasons. One, it's got to do with sexuality and our genitals, and people just don't talk about that. So, whereas with other pain, if you've got neck pain or back pain, you can say to your friends or colleagues, "Oh, I'm really struggling with this pain today." It's almost unheard of that you're going to say to someone at work, "Oh, yeah, my vulva is really burning today." So people just have no clue how common it is. But I always say to people right now, the stats are that 10 to 20% of people are going to experience chronic genital pain at some point in their lives. And that really these pain conditions are just as common as migraine headaches and high blood pressure. And we all know people who have those. So incredibly common, just like pain everywhere else in our body.
Wow. And why are mental health providers involved in treating sexual genital pain? Does this mean that it's in our head?
Yeah, such a good question. And part of my passion and why I'm so thrilled to be giving this class is because so many of my clients and patients are told this must be in your head. Just have a glass of wine. You just need to relax more. And I think when they come in the door of our office or any other mental health providers, it almost feels like that's a validation of that statement, that they're sort of thinking, does this mean I'm making up the pain? And so my big message is no, all pain is real. It's not in your head in the form of being made up, but on the other hand, all pain is produced by the brain. Even if the tissue is sending up signals through the body, all pain is in the brain. And since we as mental health professionals are really well equipped to help and manage and think about how the or how the brain works, my apologies, what we want to think about is mental health providers play this really critical role because we are able to help our clients to think about their pain differently, approach their pain differently, be motivated in different ways to treat their pain, address some of the other things that really affect pain. And one of those big things is our mental health.
Yeah, I'm glad you said that because, so many people think once they say identify a physical reason for their pain, well, a therapist can't be helpful. And they see pain management as medication. So I,
Yes.
I think it's so important, regardless of the kind of pain that you're talking about, but especially, with this kind of pain where people are often avoiding talking about it anyway.
Yes, totally. And I think that's the big thing is hopefully after this class, people will actually really see that for chronic pain, pain medication is one of the least effective treatment approaches. And that the gold standard really is multidisciplinary care that involves the psychological, the physiological in terms of some sort of pelvic floor physio when we're talking about sexual or genital pain, and then other medical interventions and a really good assessment and really proper diagnosis. That is where our physicians, our gynecologists are incredibly important for that. But the actual pain medications are generally the least effective treatment strategy.
Wow. And what is the most effective treatment for chronic genital or sexual pain?
Yeah, it's this multidisciplinary care right now. It's not one thing, it's the multidisciplinary gold standard. of the psychological approaches, and that includes the sex therapy piece as well, because sexual and genital pain tends to have really negative outcomes or negative impacts on sexuality and relational functioning. But it's the psychological, pelvic floor physiotherapy, and the medical perspective in the form of not the pain medication, but in the form of really accurate diagnosis, and then sometimes surgery and other options, medical options, after we've done the pelvic floor physio and the psychological approaches.
So a combination. And lastly, why do so many clients wait months or even years to talk to their healthcare providers about sexual or genital pain?
Yeah, it's a combination of factors, I think. For some people, it's just the embarrassment of talking to a provider about pain in that part of that part of their body and a fear of having to go through a genital exam. For some people, it's also that, especially I would say for women and people who've been raised as women, is that they have been sort of given the message that it's normal for sex to hurt. So for a lot of them, they do white knuckle through a long period of time of painful sex, thinking, well, this will just get better. People say it's normal for it to hurt when it's the first time, or it's normal for it to hurt after having a baby, or it's normal for it to hurt through menopause. Third is that, unfortunately, a lot of our physicians don't make sexual health a normal part of physical health. So they're not generally asking about people's sexual health and whether they're experiencing genital pain. So a lot of clients or patients will feel like, I don't think that's something I should talk to my physician about. So we need to kind of get past the idea that it's normal for sex to hurt. We need to get past the embarrassment that comes with that part of our body. And we need to help our physicians to open the door to those conversations much more.
Yeah, and mental health professionals alike, right? So people attending this class obviously have some interest, but we need to train physicians and really just like educate the public. You know,
Totally.
we need so much
100%.
more of this. So I'm super excited about it. Thank you so much for being here, and it's going to be an excellent class. I always learn so much from you.
Thank you. I'm so excited as well.